University of Abuja. Good morning, Professor.
Good morning. Thank you for having me.
All right, welcome.
Thank you.
Yesterday was the World Diabetes Day. How prevalent is the situation in Nigeria?
Well, the situation in Nigeria for diabetes is worrisome. As at 2018, we had a systematic review that showed that about 5.7% of Nigerians have diabetes. That's about 11 million plus people have diabetes in Nigeria, but I'm quick to say that's an underreporting really, because we have not really paid too much attention to research, so we have a gap in data collection. But luckily, the WHO and the Federal Ministry of Health collaborated. We had a national survey for non-communicable diseases recently. Data is still being analyzed, so that will give us a better figure. But I can assure you it will be shocking to us.
You mean it will be way higher
Oh,
than
yeah,
this?
it will be way higher.
That's scary, really.
Yeah.
So, looking at the situation in the country, particularly with these economic realities, it will seem like many are dying that ordinarily wouldn't die because of diabetes when it comes to drugs. So what's the situation?
It's a very scary situation as well, because, for example, the medications for diabetes that my patients used to buy at 5,000 naira per month, 7,500 per month, those medications now cost 30,000, 40,000, 45,000 per month. Per month. And so many of them are not even on one medication alone. Some have to be on 2, some have to be on 3 for us to have good control. Some are hypertensive. In fact, 70% of our patients are hypertensive. So they also have to be on antihypertensive drugs. So, I don't know, currently our patients may need like 100, 150,000 per month, depending on how many drugs they are on to have control. I don't know. It's a very scary situation to us, because what it means is that if the patients are not able to get their medications adequately as at when due, to have good control of blood sugar, to have good control of blood pressure, what we should be prepared for in the hospitals is more complications, more strokes, more heart attacks, more kidney failures, more leg amputations, more deaths. That's what
and that's actually the frightening part, the fatalities and the avoidable amputations and all of that. Now, that will bring me to the issue of the symptoms. A lot of Nigerians do not really know until they get to hospital that they have symptoms. And I understand that one of the key things in healthcare is early detection, whatever it is. Even if it's ordinary malaria, if you know early, it can be quickly tackled. So what are the symptoms that anyone that's developing diabetes will see, so that people can understand that, look, what I'm seeing now looks like this. Let me go talk to a medical professional.
Okay. Well, the disappointing thing is that diabetes may not show any symptom. That may be disappointing, but that's what it is. So blood sugar can be high. The person is walking around doing his job, feeling okay. But unfortunately, it is causing quiet damages inside. So it may not show any symptom, and that goes to emphasize the importance of routine checks. So as people go for routine checkups, blood sugar is one of the things that should be looked at. Or in fact, what we advocate now is any opportunity you have to have a patient in the hospital for whatever reason, even malaria, check the blood sugar of that person. That's what we advocate, because that's the only way we can detect early
So
enough.
it should be joined among the preliminary tests.
Definitely it should be. As you check the patient's blood pressure, you check the blood sugar as well.
Okay.
So you have a group that majority will not show any sign until late. Then we have another group that may show what we call the classical symptoms of diabetes. Okay, the person is losing weight, and there is really no ready explanation for it. In fact, diabetes can cause the kind of weight loss we used to see in people with HIV/AIDS. Okay, so
very rapid.
Oh yeah, losing weight, passing urine frequently, drinking a lot of water to replace what the person is losing, and eating excessively. So there are a group that may manifest this. So once people see this, you run to the hospital to find out what is happening. Then there's another group that, suddenly collapses in the office and say, what happened? What happened? When they take this person to emergency in any hospital, are you diabetic? The relations will say no. But when we check the blood sugar is in the sky, and that's why the person collapsed. Or you have a group that manifests what we call the chronic symptoms of chronic complications of diabetes. The person is not seeing well anymore, goes to the eye doctor. They check, it is the impact of diabetes in the eye. Or the kidneys have a problem. Or the person comes with a stroke. Or the person comes with a heart attack. Or comes with a gangrene, and we have to amputate. So these are so the best is let blood sugar, any opportunity anybody has to be in hospital for whatever, blood sugar should be checked.
Okay, I know people are already buying some, machines now to be able to check their BPs at home. Is that also, possible with people checking their blood sugar at home, and how cheap is that? So
okay, well, we have the glucometers, of course, that we encourage our patients to get to monitor their own blood sugars at home. But the bad news again is these glucometers used to cost 5,000 naira, and then the strip to check it about 5,000 also. But now, unfortunately, the bad news is the glucometers now go for like 22,000, and the strips go for 12,000. So even when you say, okay, check your blood sugars at home, there's also a challenge right now with that.
What life changes really, because we've been talking about taking drugs because you're already down with diabetes. Are there lifestyle changes that can prevent it from even happening at all?
I'm happy with this question because I know, and I have always said it, that the cheapest option we have in Nigeria with our own system, where we run an out-of-pocket system, where if an individual does not have cash in his hand, cannot access health, quality health, good health care, the cheapest option we have is prevention. And so, if people know the risk factors, why diabetes comes, then they can, fix themselves in one or the other and see what they can do to prevent it. One of the risk factors is simply aging. As we age, the body tends to misbehave, so tends to go towards the disease side of the spectrum of life. Blood sugar can naturally rise with age. Blood pressure can naturally rise with age. But if we don't want that, there are certain behavior changes, as you have said, that we need to implement to prevent getting there. The next risk factor is family history. If a parent has diabetes, one parent, any of the children has a 40% chance of having diabetes. But I'm quick to say, if you have a 40% chance of having a disease, there is a 60% chance in your hand. Get well informed, live right, and not have it. The next one is overweight, excess weight, and obesity. Excess weight on its own can bring diabetes without a family history. Excess weight can bring hypertension without a family history. And so if somebody has a family history, that person must avoid weight like plague, the way we avoided HIV and COVID, in order not to become a diabetic. The other one is physical inactivity. Particularly in Nigeria, when we are becoming affluent, we have many servants around us to do everything for us. If it's possible to help us carry our hand and our leg, we will prefer it. People need to be active. Excess weight is simple economics. When your input is more than your expenditure, there is an imbalance that settles as fat. Because the way God made the body, we are meant to burn out whatever we take every day, each day, to maintain metabolic balance and maintain health. And the issue of diet is a big issue in Nigeria. If you see us at buffet, that large plate, if you see the way we fill it to the brim, and in 10, 15, 20 minutes, that plate is empty. That is a terribly unhealthy way of eating. And so we need to reduce the portion size. The way we eat too much more than the body needs. We put in too much more than the body needs. And so we have this excess that settles as fat. So we need portion size small. That average plate, if we divide it into two with an imaginary line, half of it should be vegetables, whatever type we like. We are not specific as long as the name is vegetables. Now the other half we divide into two. We have a quarter. That quarter is where everything we want to eat should be, the size. when people want to eat pounded yam, those who love pounded yam or swallow, I say the size of my fist, not their own. If he does a feast now, his own is very big. So
exactly.
his own is very big. So the size of my fist, and you eat with a bowl of vegetables. People will say that size is very small, and I tell them no, that vegetable is bulk. It's going to fill the space. You won't feel hungry. And the fiber in it will help to delay the rate of digestion of the pounded yam or the rice, so you're not going to feel hungry. It will be there. And then the rate of absorption of glucose is also lowered. So blood sugar is not going to jump up, you know, the way it will do if we take a bottle of fizzy drink or something, but it will rise gradually. And then oil in our food is very important. We must step down the amount of oil. Whatever the name of the oil, whatever the name of the oil is, it is better we step it down to barest minimum, okay? Because when the oil level in the blood is high, it behaves like gum. It blocks the blood vessels. And the notorious ones are the ones to the brain, the heart, and the legs in people with diabetes. When the brain does not have enough blood supply, there is a stroke. When the heart muscle does not have enough blood supply for nutrition, there's a heart attack. So as we age, we need to step down these things. Reduce the amount of salt in our food, reduce the amount of oil, reduce the amount of sugary things that we take.
Sugar-sweetened beverages, I was coming to that.
We have sweet mouth. In Nigeria, our mouth is too sweet.
So essentially, it's important for everyone to live healthy lifestyles. Yeah. But things like smoking, do they predispose people to...
Smoking is one of the risk factors for diabetes. And it has to do with both those who are active smokers and passive smokers. So if somebody is smoking over there and I'm here, I'm inhaling the smoke, so I am also at risk of diabetes and even, you know, lung diseases, lung cancer, and the other things. Alcohol is also a risk factor for diabetes, and it can worsen the complications of diabetes.
All right.
So we need to take a quick break now. Let's take a breather. We'll come back to wrap up this discussion.
Our guest is still Professor Felicia Anoma, the president of the Diabetic Food Nigeria Initiative and former dean of Faculty of Clinical Sciences at the University of Abuja. It's been a very enlightening session with you, Prof. And you've talked at length about the risk factors. Now, I'd like to know, for someone who has found himself to be a diabetic and is are there government initiatives that can help people who are, let me say, indigent now, to access treatment in order to manage diabetes?
That's the crisis we have right now, especially with the new dispensation that we are in. The health insurance scheme coverage in Nigeria is about 5%, unfortunately. And so individuals are virtually on their own.
Does it cover diabetes even? Because I know there are some exemptions.
It covers diabetes to some extent, but the complications of diabetes that are so costly, that are so expensive, there's a problem there. I mean, if somebody comes with, you know, kidney failure or with amputation, the person is responsible for his or her care. So we have a big challenge there. Well, we are trying to, I mean, the Federal Ministry of Health is doing their own bit, but we need to do more. Policymakers, they need to do more on behalf of people with diabetes, because they cannot be left on their own. Outside this country, they are not left on their own. So they cannot be left on their own. They need support. So we need policies, we need legislations that will help. Okay, even if it's the medications, you know, some removal of waivers, you know, on these medications to step it down, since we have to, they are imported drugs, and we know the meaning of anything imported now, what it means. So these individuals are virtually on their own for now, and that's why we are pleading with government. They need to come to the rescue of these individuals suffering from diabetes.
Some advocates are actually advocating for an increase in SSB tax, that's the sugar-sweetened beverage tax, saying the current tax on them is so low and does not dissuade people from, you know, taking them.
The coalition...
Sorry, before you go on, I'd like you to join that to cultural factors too. Okay. There are ethnic nationalities in Nigeria whose diet is predisposed towards sweet things.
Okay.
So, in joining with what she just asked you,
Yes.
how do we also tackle that?
Actually, there are cultural beliefs we have that are counterproductive to prevention of non-communicable diseases, including diabetes, hypertension, and the rest. One of those cultural beliefs is, our belief as regards weight. Weight in our setting commands respect. Weight shows that the person is, affluent,
Prosperous.
is having a good life. And so when people are slim, you go anywhere, you greet, they may not even answer you because they have, sized you up. So we need to remove that from our brain, that excess weight has no medical advantage of any sort. It's just a reason for disease. Pot belly, what we also believe about it. But honestly, the unfortunate thing is that the earliest evidence of diabetes is on the road, hypertension is on the road, is the pot belly. That is the evidence that that person has started that journey. But all hope is not lost. If the person realizes the meaning of that early enough and begins to work on it, can come back to the healthy side. Okay. So another thing is oil. There are some cultures that when you don't have enough oil in your food, you are looked at as being poor. You can't afford it. But unfortunately,
it's not red enough.
It's
so
not
that
red
means
enough.
It's not
Unfortunately,
enough.
We have mentioned the meaning of too much oil in our blood. Okay, so
the
SSB tax. Yes, there's a national association for sugar reduction in Nigeria, and that is a coalition of about 10 organizations. I belong to that, and we've been struggling, with discussing, having conversation with government as regards increasing, sugar tax on these sugar sweetened beverages, because excessive sugar consumption can cause diabetes. What happens is sugar, anything sugary, is in its most easily absorbable form. It doesn't need any processing anymore. So once you drink it, it runs to the blood to spike the blood sugar. And now, blood sugar is not meant to be up. So when that happens, the body quickly secretes this famous hormone called insulin to bring it down. When you harass those cells with all these sugary things too much, those cells at a stage get exhausted, and there is no coming back, and diabetes shows up. So, and WHO has recommended that the tax that can make sense, that can have impact on health, is 20% tax. Well, as we succeeded in getting 10% from government, but that organization is still in conversation with government to step it up to 20%. The idea is when you increase the tax and it's expensive, it's going to discourage people from consuming these things, and we have positive health outcomes from there. And that is what is important. Everybody wants to live well, but the industries are fighting it very hard.
And the tax can actually be plowed back into what you're talking about, helping
what we are
those who are already
into
down.
health again, so that we can, support these people suffering from diabetes and other chronic.
Now that's Nigeria, of course, it's part of Africa. But the papers this morning are reporting, based on the World Diabetes Day, that the WHO is calling for urgent intervention to avert rise to 54 million in Africa by 2045.
Yes.
Meaning that if nothing is done, then we'll have a case in our hands.
Yes. We have a time bomb that has already exploded. But if we take action now, then we can, do something to help this situation.
Okay, so that's about diabetes, which is just one of the non-communicable diseases. What about others? Is it one leading to the others, or a complication from diabetes that results, particularly stroke? The rate at which people are going down now with stroke is something else,
yes.
Particularly even young people who never had it before.
Yes, what is happening to us is we got civilized, so we civilized everything about us, and we began to acquire the diseases of civilization. Diabetes is a disease of civilization. Hypertension is one, and then strokes and heart attacks, they are complications of diabetes, hypertension. And the fat cell, I want to mention something very important. The fat cell is the origin of all this. When you feed the fat cell, and you allow it expand, it secretes substances that, cause problems, that lead to diabetes, that lead to hypertension. You have said if one leads to the other. The truth is diabetes and hypertension, they are brothers and sisters, and they like to exist together. So blood pressure may show up first. Before you know it, blood sugar is showing up. Or blood sugar comes up first. Before you know it, hypertension. So all the strokes you are talking about and the heart, they are complications of these diseases that we brought. Even when people talk about genes, I say genes are not dictators. They are dormant. Gene expression is not 100%. it is environment that goes to wake up the sleeping gene. It's like we have a slang in Nigeria, trouble they sleep, nyanga go wake up. So we use our lifestyle to wake up the dormant gene, the gene that is just there on its own. So even if people have the gene, hereditary, just like I said at the beginning, you have a 40% chance of having a disease, but you have 60% chance in your hand to live right and not have it. So gene is sleeping. But our lifestyle, the way our eating, how physically active we are, smoking, alcohol, all those things we do, they are the ones that wake up the genes.
So both sugar and salt are problems.
Oh, yes, because excessive salt will cause blood pressure. That's why when people go to hospital, they say, reduce the amount of salt that you take.
All right, Professor, it's been a very engaging discussion with you. And what else would you expect from a professor? Thank you so much for talking to us this morning. The president of the Diabetic Food Nigeria Initiative, Professor Felicia Anoma, has been speaking to us about the World Diabetes Day and, of course, all the issues surrounding diabetes and the attendant complications that could come from it, the issues surrounding medication, lifestyle, and all of that. It's been a whole lot of stuff, but very interesting. Thank you so much for coming.
Thank you very much for having me.
All right, to have a great day. Okay, we'll be taking a quick break, and when we come back,